This week on LTC News, stories of human rights.
You do not get a cookie for acknowledging a movement that's been going on since your great-greats were even thought of.
Restaurants adapt for the future.
It wasn't for the people locally, the customers that we have, our regulars that come in and support me all the time. I think I would have been more worried.
And the health department gets new leadership.
I just kind of stepped in and, lent another hand and tried to get things going in the right direction.
All this and much more on this edition of LTC News. Welcome to LTC News. I'm your host, Matthew Nelson. The May 25th murder of George Floyd at the hands of Minneapolis PD officers sparked nationwide protests and discussions on the matter of racial equality in the United States. Here in Lowell, city officials put together a listening session which invited members of the public to come forward and tell them their struggles with race and human rights. In our first segment, we'll hear some of those stories.
My name is Thaddeus Miles. I've lived in Lowell for 30 plus years. My area of statewide work is housing, public safety, nonprofit leadership. I'm also a funder. I currently fund several programs here in Lowell. Yet over that same period of time, last 5 years, in Lowell I've been called monkey, told to go back to my country, been told that my husband is a Lowell police officer and he's locking up all you and I hope you're next. I've done business in City Hall, other government offices here in Lowell, and rarely do I see a person that looks like me. But I'm always made to feel black.
The amount of effort Lowell has put into that new Justice Center is the effort I need to see white people have in dismantling these institutionalized racist systems in Massachusetts and America altogether. Watching this new Justice Center form is its own prestige is one of the scariest things to witness because the possibilities are endless behind those walls. I'm so tired. Allies, I see you. And you know what? It's not my job to pat you on the back either. Although you're going to do it yourselves anyway. I've been going through this. And you do not get a cookie for acknowledging a movement that's been going on since your great-greats were even thought of.
When I first walked into Lowell High, I had really high grades when I transferred over from Innovation Academy, but the lady who tried helping me, she tried putting me in all college classes, even though I had not one B. And I just knew how the system worked, so I told her, no, please put me in all honors. She said, can you handle it? I'm like, of course I can handle it, I have no Bs. Why would you just assume that you want to put me in college classes? And they tried doing the same thing to my little brother who had all A's coming from middle school. So already right there, the education system has already been set up to fail black minority students at Lowell High.
These stories, these experiences each matter, and they need to be woven into the history and fabric of our city and told to our children and preserved in our museums, parks, and libraries, just like the stories of the mill girls and the immigrant worker. The next part of our Lowell story needs to include how everyone, including our legislators, elected and appointed officials, local leadership, and everyday Lowellian work together across the city to develop a cure for the racism that exists here in our backyard.
We care about your actions, not about your words. I need you to get informed. I need you to get more in depth. I need you to tell us what you're going to do and what you're going to accomplish. If you're not working towards a solution, you're not working with us, but rather enforcing the change that have kept us suppressed. Again, thank you. My name is Thaddeus Miles, and I will say that 2 minutes is not enough time for a black man to talk about systemic racism. Have a good evening.
The full listening session is available to watch on our channel's website and YouTube page. City government officials said they would be open to holding more of these meetings in the future if the community wants more opportunities to be heard. On Saturday, June 20th, the Ralph F. Brown Jr. chapter of Blacks in Government hosted a Juneteenth picnic at St. Anne's Church in Lowell to bring community members together to learn, eat, and socialize safely in honor of the holiday.
So this event today is celebrating Juneteenth, which is, just in a quick explanation, the mass exodus of celebrating the ending of slavery, when people that were enslaved actually got to know and got to understand that they were no longer slaves.
President Abraham Lincoln issued the Emancipation Proclamation on January 1st, 1863, as the nation approached its third year of the American Civil War. It did not free all enslaved peoples. It applied only to states that had seceded from the United States, leaving slavery intact in the border states loyal to the Union. The Emancipation Proclamation also expressly exempted parts of the Confederacy that had already come under Northern control.
People are definitely taking information away. They are finally understanding, if they have not understood before, why we celebrate Juneteenth, what happened to lead up to the events of Juneteenth. They're possibly even learning more about the Civil War than what they knew.
Galveston, Texas was one of the states that the Emancipation Proclamation included, and therefore the enslaved in Galveston were freed as of 1 January 1863. Texas was one of the last strongholds of the South. There was no means to enforce the Emancipation Proclamation on the Texans due to the minimal number of Union troops in the area. Therefore, the Texans did not inform their slaves of their freedom on January 1st, 1863. They waited 2.5 years later when Union soldiers landed in Galveston, Texas, and told them the news that the war had ended and that the enslaved were now, and some had been, free. Every 19 June since 1866, the former enslaved peoples and their descendants celebrate this day as a day of freedom.
So Blacks in Government is a national organization, and it was started in order to bring equity and training and job promotion for those individuals that were not being serviced as well. So we normally have a National Training Institute every year, but of course because of COVID it's being canceled this year. But we also provide public communication trainings for the youth, scholarships to give to the youth. We have a lot, and it's not just for state and local and federal representatives, but it's also for college students and it's also for high school students, because we believe in education. We believe that everyone who wants to join the government, we want to make sure that you have a means and a vehicle to join the government. We put this together so that anybody can walk through. It's also COVID friendly. Get some free gumbo, which was a delicacy of the time that we still eat till this day. And as you can see, we have people here. You can talk, and then you can go on about your way and invite other people to come, learn more information, get more gumbo, and then just enjoy the day.
I've lived in Lowell, been here, I'm part of the community, and thought this was so important for us to highlight exactly what's been going on within our heritage this entire time, and especially this is just the moment in time where it just works and people are listening, and they're really listening. And so we're super excited that people are coming out to actually learn and get a little bit of education too.
The Lowell Department of Health and Human Services got a new director in April, just as the pandemic was surging in Massachusetts. Joanne Belanger came from the health department in Andover with 30 years of public health experience. She jumped in to help deal with safety protocols and contact tracing in the city.
Can you tell us a little bit about yourself? I understand you grew up in Lowell.
I did. So it's very exciting to be back here. It's like, the coming home in a career. So it's wonderful to be back in the city. I have been working in public health for, over 3 decades, and mostly in the town of Andover. And for the last 20 some odd years, I was the assistant director And as a nurse, that position was day to day to run the clinical side of public health. So I would say public health is like a triangle. There's an administrative piece, an environmental piece, and a clinical piece. So I've been running the clinical piece and doing the administration for the last, 20 some odd years. So, that would be the communicable disease surveillance, which is here we are in a pandemic. So,
What was it like jumping in at that time?
coming in the middle of the surge, it was pretty interesting. I will say that they were working really hard here. I was very impressed with, everything that was up and running and the programming and all the protocols that were already in place when I got here. So I just kind of stepped in and, lent another hand and tried to get things going in the right direction. We've been able to keep the tracing work in-house. When someone gets a call, for the most part, they were people from the health department, nurses from the health department that were reaching out to our residents and making sure that they were healthy and safe.
And that probably helped with compliance and answering the questions because there was more of a trust.
Yes, I hope so. I think, in situations like this, there's always, bad elements that surface, and people should be wary. I know I don't answer the phone if I don't know who's on the other line, and then I wait for a message, but we had that capability to leave a message right from the get-go with a return phone call, with a Lowell exchange. So hopefully the trust was there, from the beginning.
Yeah. And has it made a big difference? Are the numbers falling substantially in Lowell?
Our numbers have dropped just like they have throughout the Commonwealth, which is an excellent thing. And, I just encourage everybody, don't give up. Don't think it's over. You put your seatbelt on, put your mask on. It's kind of a new way of living. We were lucky when we had the CVS testing site. I think, we were the third, in the Commonwealth in terms of residents that were tested. We were over 18,000 people that have been tested in the city. So I know with that leaving, that's, going to be, an issue. There's still testing available, but people are going to have to seek it out a little bit more.
Well, if people want to know where to get tested, how can they find out?
The best thing I think right now is to go on the Mass Department of Public Health, mass.gov website. There is a link to all the testing in the Commonwealth. I really want people to reach out and let us know what you're seeing, what you're feeling, that kind of stuff. We want to stay open and accessible to the residents. I'm just really very excited to be back home.
As cases of COVID-19 in the Commonwealth begin to decline, efforts to reopen the state have begun. Lowell recently adopted regulations to allow for businesses to have socially distanced outdoor dining, and in this next segment, we'll hear from several restaurant owners about their experiences during the pandemic.
On March 17th, they were shut down, and a lot of them adapted to a takeout model, not because it was necessarily something that was going to bring in a lot of revenue, but for them to keep relevant and for them to bring in hopefully enough to keep the lights on.
Most of us dependent on the foot traffic, especially during this time. We relied on the summer events, as you guys know, the folk festival, the conventions. That was very, very good for us. Unfortunately, I think the impact is being more on how we pay the bills. Rent continue the same, light, utilities, everything. It's been the same. But I believe most businesses have decreased their sales between 50 or 70 or 80%. So if you can put that on numbers, it's hard for us, to come up with a rent on full when our customers, have decreased. It's something that most businesses have to struggle with. Unfortunately, nobody's gonna give you a deal for half rent because that unfortunately didn't stop. That's the only thing COVID-19 hasn't stopped it yet.
I was very worrisome, but Governor Baker allows us to do takeout, which is great. I was nervous in the beginning at first, absolutely, but thanks to the great city, my great customers, great neighborhood, these guys came every day or every week supporting the cause. So I was able to stay afloat during this whole pandemic.
And then we've recently shifted into outdoor dining and now indoor dining. So they're finding that many restaurants are very successful in the fact that they're booked throughout the entire time that they are open, but they're still only bringing in about 25 to 30% of the revenue that they would have at this time last year. So while it looks like they're busy outside, there's still a lot happening behind the scenes.
The outdoor streetery is definitely a godsend. The city really came through with this thing. There's no way we can have customers without it. Even since we've been able to bring people inside, we haven't really had more than maybe 4 people who were willing to sit inside. But we're doing takeout, we're doing delivery, things we weren't doing before because we considered ourselves a meeting place. But when that got turned off, we had to think quick.
It wasn't for the people locally, the customers that we have, our regulars that come in and support me all the time. I think I would have been more worried. But with those guys coming in every single week for me, I have no complaints about it. And I think I lucked out very much during this whole pandemic compared to a lot of other people. So I'm very happy. So that's all I got to say. And I want to thank everybody for that. You know, if it wasn't for them, I wouldn't be here still.
In this week's Sunspot, Lowell Sun Enterprise editor Chris Scott sits down with Lowell City Manager Eileen Donahue.
Good evening, everyone. Thanks for tuning in to Sunspot. This is now the 114th episode, and we're resuming the every other week series. And I thought that it was very appropriate to have on Lowell City Manager Eileen Donahue, who's been navigating some pretty perilous waters over the course of the last several months since Governor Baker declared a state of emergency. I've been covering the city now for many, many years, and I've seen city managers weather all kinds of storms. But I don't think any manager has had to face what you've had to face here.
You know, it truly has been an incredible period of time for everybody. As we know, it's affected everybody so dramatically. The virus and the pandemic, it's not something anyone has been prepared for. But yet you had to become prepared overnight, and that's where we found ourselves.
So now we're 3 or 4 months later. What was the peak of, and we talked a little bit about this earlier, what was the peak of Lowell cases and how many deaths did Lowell see due to the pandemic?
I think we saw, in terms of the number of daily cases, it really peaked in April. And second, third week of April, we saw a huge number on a daily basis. Our total number of cases to date since March is 2,895 total cases in the city of Lowell. And the total number of deaths is 131 deaths as of today. So, and you know, as we've talked about before, it remains true today. The vast majority of those deaths, unfortunately, occurred in our nursing homes. You know, over 80% of the deaths are attributed to nursing home patients who succumbed to the COVID-19 virus. So, you know, it's been a challenge. We set up our emergency operations center day one and had that operating. And you know, as I said, the first focus has been on health and making sure we shut City Hall down. We had all hands on deck. Everybody has to work through this pandemic because we're essential services. So we didn't have the opportunity to go home and wait it out. We've been here ever since. Some employees were able to work remotely for a period of time, though they're transitioning back to the office.
Has City Hall reopened?
Not to the public, it's to the employees. And, you know, that was another pivot that we had to make, namely, you know, to transition to continuing business, operating City Hall at full tilt so that services are rendered to the residents, but doing it remotely, online services, and as well as those who wanted to do things in person. And so we've made adjustments. We've learned a lot throughout the period, and knock on wood, it's gone very, very smoothly. Occasionally there are people who like to drop things off. We installed a drop box on the city plaza side, the JFK Plaza side of City Hall, where you can drop payments off that are collected a few times a day and distributed to the respective offices. It's all gone very smoothly. And again, right now, we haven't opened the building to the public. Lots of communities haven't. The state hasn't opened up all their buildings yet.
When do you think that might be realistic?
We're going to continue to look at the data and look at the cases and look at our situation here in the city. It's important that employees are safe as well, and that, when we made the decision to close City Hall, I had done some informal polling of department heads, just trying to get an idea of how many people their offices see on a daily basis, with the building being open to the public. And we calculated that it was close to 1,000 people a day coming into City Hall. That's a large number of people. And we need to make certain, is there a better way for us to serve the public and yet be protective of our city workers? And so that has required doing some adjustments to workspace, some plexiglass improvements, some movements of desks. There's just a whole lot of physical activity around that. But I will say throughout this, every department has been completely supportive of the efforts in and around the virus, making sure the city still functions, making sure that we're able to deliver services. And let's face it, this has been a stressful time, I think, for everybody. Right. Now so we aren't out of the woods. We're pleased that the cases have gone down in recent weeks. Very pleased about that. We monitor it every single day, obviously. Our health department is continuing to do the calling, the contact tracing, the case research and investigations, so that we are monitoring everything that's happening here in the city. But we have to be prepared. Things can change quickly, as we've seen with this virus.
Well, I'd like to follow up on that, but just before I pose a question on that, just going back to the numbers for a minute, the total number of cases and the total number of deaths. Yep. How do those numbers stack up to other similar sized cities across the Commonwealth and or gateway cities?
I think we're not the highest per capita, but we're up there. So, Chelsea is one that you saw an extreme number of cases based on the population. Lawrence is another one that has surpassed in terms of ours, though ours are pretty significant. They're not the highest, but they're certainly significant.
Right. I know that you're looking at the numbers, and we talked about this earlier, the numbers and the trend as being positive. But when we spoke earlier this weekend with schools set to resume in September in some fashion, but we don't know what that fashion is yet. Tell me what your concern is, what your concerns are with that.
Again, health concerns. First, we have our K through 8, and the superintendent and his team are looking at plans. The Commissioner of Education is asking for 3 scenarios. One would be everybody back in school with distancing and all the requirements met. What that would look like, setting up classrooms. The second option would be a hybrid situation, kids in part-time, remote part-time, and kind of transfer, trade off. And then the third option is all remote, if that needed to be the situation. So they're in that planning phase right now, and I speak to the superintendent regularly. Look, bringing kids back, we want to make sure it's done safely. We want to make sure that we don't have another outbreak of the virus. All of the medical information and research says that kids are not as highly susceptible to the virus. The kids aren't super spreaders of the virus. So I think the medical teams feel that it's relatively safe to bring kids back to school. That said, we're an urban district and we have some crowded classrooms. And when you need to space them at least 3 feet apart, but preferably 6 feet apart, you're cutting down, obviously how many kids you can have in a given classroom or space. That coupled with having the appropriate staff and teachers to deliver the educational services, all while we don't know what a budget's going to look like at all. And so, we started out in January looking at the governor's budget, looking at consensus revenues that were indicating that the schools could expect to receive $12 or $13 million more this year than they had the year before, a significant increase. Those numbers are out the window, and now the question is how much of a cut to the current budget can they expect?
Right.
And really, can they sustain? Because everything having to do with the virus costs money, whether it's properly distancing, whether it's providing the PPE, whether it's providing the necessary cleaning services. You are spending money you didn't budget for.
The busing contract in Lowell is huge. On any given morning during the school year, you see buses just crisscrossing the city. But if students have to socially distance, I would imagine that the financial impact for busing could be astronomical. And I'm wondering what type of conversations are already going on with the school department.
There are lots. That's a big challenge because the early guidelines on busing required one student per seat, every other seat. So you would put maybe a third of the students, if you were lucky, on the bus that you otherwise would. In addition to that, the answer isn't necessarily running more routes or back-to-back routes, because after each run, the bus has to be totally sanitized and cleaned.
Yeah.
So very, very big challenges around busing. Some of the things being spoken about at the state level, what should a district do? Some are suggesting come up with schools where the vast majority of the kids can walk to school, neighborhood schools, go back to walking routes. So I would submit that I think everything is on the table at this point. Again, at this point in time, from education, whether it's education or even municipal budgets, your budget is pretty much set. And now you're implementing that in your programs and your goals and so forth for the next fiscal year. Nothing is set right now, despite the efforts 24/7 of everybody involved.
I'd like to get your reaction to the governor's decision this week to relax travel restrictions to Massachusetts. It seems that, and again, we talked about this off camera, that we're lucky in that we're in the Northeast, and chief executives like yourself have looked at this in similar fashion and really, closed down the hatches early and took the air of caution and did not reopen. But there's spikes all across the country. What do you think about that, relaxing travel restrictions from the contiguous New England states? And I think Governor Baker included New York and maybe New Jersey in that as well.
He did. So it's New England, New York, and New Jersey. I think those, I think the governor has been cautious and has been conservative in his approach, but at the same time has been aware of let's face it, the economic impact all of this has had. And it's a balance, and I think he's erred on the side of caution, rightfully so. But I think this decision, the data, because it is very data driven, supports what he's saying. The hot spots remain a problem, and so someone traveling to or coming from a hot spot right now, many of the other states, there has to be a 14-day quarantine, and that I think is going to happen. That can change, and that's one of the things that we've learned from this virus. What's a hot spot today may not be tomorrow. Wasn't that long ago that people thought of Massachusetts as the hot spot. If you went out of state, someone saw your plate was from Massachusetts, you were not welcomed with open arms.
Thank you, Eileen. Have a good day and stay healthy.
You too.
Thank you. Thank you for tuning into this to Sunspot, the 114th edition, and hopefully we will get this going on a every other week basis. Have a good night, everybody, and stay healthy.
Keep an eye out for an extended cut of Chris Scott's interview with City Manager Eileen Donahue on our programming schedule. That'll wrap up this edition of LTC News. You can find us on LTC channels 8, 95, and 99, online at ltc.org, and on Roku in the LTC News playlist, on Facebook at LTC Lowell, or on our YouTube page. I'm Matt Nelson. Thanks for joining us.